Hello, everyone. It's John Benko, the Director of Nursing at Belfair. It is April the 30th, and this is a COVID update. Earlier today, about 18 hours ago, I took my temperature. It was 97.8 degrees Fahrenheit. Want to remind you all to take your temperature. Make sure you don't have a fever. By that, we mean your temperature should be below 100 degrees Fahrenheit. And we also want you to make sure you have no other symptoms of any illness. If you have an illness or if you're not feeling well or you have a fever, you need to stay home and not report for duty. Just like we're screening all of your health, we're screening all of the residential clients here on campus, taking their temperatures at least twice a day and keeping an eye on them. Currently, we're happy to report that none of our residential clients have any signs or symptoms of the COVID-19 virus, and none of them have a fever. I wanted to maybe check in on some numbers. We haven't done that for a while. So if we look at the numbers surrounding the trajectory of the disease, we can see here that in the United States, while we still have a strong number of cases, and this is still very serious, we see that we're starting to level off a little bit. You see how that trajectory kind of flattens out a little bit. So that's important because that is meaning that, first of all the efforts of staying home and locking down and making sure we're not spreading the virus are working. And that has also generated all the discussion about opening up the economy or getting society back to whatever that new normal will be. So that's where some of those ideas come from. If we look specifically at Ohio, we can see that the numbers, of course, are slowing down. We're still climbing. We're still in the midst of what we're dealing with. However, we have leveled that out quite a bit. So we've lowered or flattened that curve. It's still climbing a little bit, but we've lowered it enough to where it's making some sense that we can start making some decisions about what the next phase of our mitigation efforts will be. What I think is really important is if you pay attention here on the bottom here in some of the narrative, you'll see that we're doubling our cases in Ohio every 13 days just about. When I started having these videos and we started discussing this, we were doubling every 2 days. And we were very happy when we changed that to every 4 days. So our efforts are working. We need to keep them up. So what's going to be next? How do we keep ourselves safe moving on? We know that we have to start increasing the openness of society. Well, we're going to talk about masks. You're going to hear about cloth masks, face coverings, as the governor and the state of Ohio like to say, and that's appropriate because they're not really PPE. What we're talking about is just cloth face coverings. We need you to cover your face, your nose, and your mouth so that secretions don't leave your body and go into someone else's. The reason that's important is many people who may be infected with the COVID-19 virus, we know, and we're statistically validating this every day more and more, will be asymptomatic. They won't know they'll have it. So as we go out into the community, if we were to cough or sneeze, and those secretions were to reach someone else, we would infect them and vice versa. So those cloth face coverings, that is there. Mine will be on to protect you. Yours will be on to protect me, and we will help mitigate that. We do need to have some precautions in mind when we're using cloth face coverings. They need to be clean, right? Clean them every day. Make sure they fit over your face and mouth. Find one that you're comfortable with. We're going to be doing this for a while, folks. And if we're going to be doing that, you should be comfortable. You have to be able to breathe. Find one that works for you. The agency is making great efforts to get cloth masks to everyone, at least one or two. But they're available everywhere. Folks are sewing them. If you need some, reach up to your supervision, your divisional managers. We're getting them in every day. We're getting them out. We have many considerations when we look at our face coverings, the selection here at the agency. Some of us are out in varying settings. Some of us are in congregate care. Some of us go into clients' homes or into other public spaces. So we all need to be covered, but we have to take into consideration the clinical implication of covering and the safety implication of covering. The agency will be getting more guidance out. I know leadership is working on that. They were working on it late until this evening, and we'll get some more words out so far as some clarification on how and when we're going to want everyone to mask up. By and large, if you're out in public, if you're meeting with someone, if you're coming to the administrative building, etc., we're going to be looking for you to be wearing a face covering starting on Monday. But again, that guidance will be coming down to you through your supervision. We're taking very careful steps to balance the clinical needs of our congregate care clients as well as the safety of them and each other. So we want to make sure that we're doing everything we can to keep them safe and that we're looking at everything so far as safety and good clinical guidance. So you'll hear about that. We'll be talking a lot about it. We'll make sure that everyone is being as safe as they could be and as appropriate clinically as they could be. So we're going to use the science to the best of our advantage, and we're going to implement that as it makes sense and as it makes good safety and good infection prevention. Speaking of good infection protection, we need to get back to that great hand hygiene that we were all doing so wonderfully over the last month. Wash your hands, wash them often, use a hand sanitizer, soap and water for 20 seconds. Remind each other, don't touch your face, even if you're wearing a mask, and maybe even more so if you have that face covering on, because that face covering is there, gives you sometimes a false sense of security, or it makes you forget about it. You cannot touch your face, don't touch your eyes, your mouth, your nose. When you're removing your mask, do so by the straps, right? When we're using any kind of protective garment, including a face covering in the healthcare setting, we always remember that we're facing whatever we're trying to avoid so far as contamination. So that's considered the contaminated area. So we don't want to touch the face of that, right? Just in case, we've come into contact with something. And it's very important that your mask is clean and dry. I've mentioned before, a good container for your mask when you're not using it is a paper bag. Paper can act as a desiccant. It'll get some of the moisture from your breath out. Hand washing is fine. Hand wash with some soap and water. Rinse that out real good. Wring it dry and hang your mask up overnight. So we're going to be looking for everyone to be wearing some face covering in some form or another moving forward. We're going to ask you to please give strong consideration and help each other mind your physical distancing. We know that many of our areas are tight. We know that we have to do some essential work that involves us integrating ourselves into other people's space, but we want to keep that 6 feet whenever possible. And we want to, of course, keep the hand hygiene and good sanitation, right? All flat surfaces, your desks, your keyboards, light switches, doorknobs, frequently used areas. We want to wipe them every time we use them, and at least twice a day. We want to sanitize them. Our facilities department has done great efforts in getting supplies in. Go through your normal supply chain. Get whatever you need so far as sanitizing wipes. We have it. We'll get it for you if we don't. Just like we're doing with the screening, the continued hand sanitizing, the continued cleanliness around the offices, and the wearing of face coverings where appropriate. We were going to stay on top of whatever it is we can to mitigate it, any spread of the COVID-19 virus, and keep us all safe and well. Speaking of safe and well, we have to look after ourselves. We know that the stress is not going away. In many ways, it will increase for us because as the economy and society starts opening more, we will all be exposed to more folks who we haven't been before. So those non-essential workers are going to be back there in society. We'll have a chance to bump into them. Some areas that we couldn't go into before, some stores, shops, restaurants, and different things, will start to be opening in a gradual, incremental basis. And when they open, we're exposing ourselves. Even with those face coverings, we have to be very careful. So stay mindful, keep vigilant, and realize that this is difficult. It's going to get sometimes confusing, and that means stress. So whatever you can do to mitigate the stress, talk to each other, or reach out to whomever you normally work on your stress with, exercise, relax, try to eat well. I know we're all putting on that COVID-19, and we need to maybe increase our physical exercise. It's good for us. Spread kindness, not virus, right? When you're kind and you're helping each other, you tend to be happy. When you're happy, your immune system functions better. You need that immune system. We need you to be healthy and help us continue this essential work that we're doing. So do what you can. If you need help beyond what you can normally put together yourself, remember, one of the things you can use is the Employee Assistance Program. We have a great one here throughout all the Wingspan agencies. Reach out to your immediate supervisor or your HR department, or email me and I'll get you that information so you can reach out to the Employee Assistance Program. You can reach me for that or any other reason at benkoj@wingspancg.org. So a little bit of a later update, a little bit of a longer one, just reminding you things are going to be changing, but we're all in this together, and we'll do quite well through it, continuing to do what we do. So help each other, be kind. Remember, spread kindness, not virus. If you need something, certainly let me know. If I can help you, I certainly will. And I'll remind you to please wash your hands and stop touching each other. Be well. We'll talk soon.